Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today's Monday, July 13th, and this is my daily briefing. Um, First, I want to apologize for getting the briefing out so late today. It's definitely been a Monday, and we've all been very busy, so if you could just bear with us, we're going to try and get it out a little bit more timely for the rest of the week. Also, I'm working at home, so you may hear a little bit of background noise, but, little kid chatter or dogs barking, so I hope it's not too distracting, but I just wanted to let you know that up front. So to date, we've had 138 cumulative positive cases in Missoula County. That's up 12 new cases since Thursday of last week. 135 of those cases were identified by testing and 3 were epi-linked. We've had 94 recoveries and 1 death, so we currently have 43 active COVID-19 cases with over 320 close contacts. Active cases and their contacts are in quarantine and isolation and are continuing to be monitored and supported as needed. And there are currently 2 hospitalizations in Missoula County from residents of other counties. The state of Montana is reporting 1,843 cumulative COVID cases, which is up 85 cases since yesterday. There are now 936 active cases in the state and 28 hospitalizations, with 32 deaths to date in the state of Montana. Today, I want to take some time to clarify some things that we're hearing that people have questions about or that we've seen some misinformation floating about in public forums. Let's talk about the face covering rule that was passed by the Board of Health on Thursday of last week. First, we've seen an immediate and awesome improvement in the number of people who are wearing face coverings. So I just want to say thank you to everyone out there who is wearing those face coverings, and thank you to our business community for working with us to protect the health of the public and really reduce the transmission of COVID-19 in our communities. I also want to remind everyone that it is up to the business to enforce the face covering rule, and no business is exempt from this. There's some misconception that businesses who were considered essential while we were all on the stay-at-home order from the governor are exempt from enforcing the face covering rule. The distinction between essential and non-essential was removed when the governor moved us into phase 1. So there's really no difference anymore between the businesses. All businesses that are indoor spaces that are open to the public must enforce the face covering rule. If we get a complaint about a business that's not enforcing the rule, it's passed on to our enforcement team and they will follow up with that business. We've also gotten a lot of questions about whether face shields can be used in place of cloth face coverings. Face shields should not be used in place of a cloth face covering. The reason for this is that the cloth mask is meant to protect other people from your germs in case you're infectious and just don't know it yet. Face shields are plastic shields that cover from the forehead down to the chin, and they're open at the bottom and on the sides. These are primarily used in medical settings and are used with a face mask under the shield. The face shield is meant to protect the wearer's eyes and nose from droplets of another person, but they do not protect another person from the person wearing the shield. Therefore, face shields are not allowed under the rule as a replacement for a cloth face covering or mask. For those who are working with someone who's hearing impaired, there are masks available that have a clear plastic rectangle so that the lips can be seen for lip reading. There's also an allowance for people who have certain health conditions to be exempt from the rule. There's a link at the bottom of the rule, which you can find on our website, that takes you to the ADA webpage with details of what conditions would make a person exempt from a face covering rule. This does not necessarily mean that those who meet this exemption can be in indoor public places, but it does mean that businesses must make accommodations for someone who cannot wear a face covering, such as curbside pickup or delivery. Again, take a look at the rule on our website at missoula.co/cvirus, and you can scroll to the bottom of the rule on page 2 for the link to the ADA site for more details. I also just want to let everyone know that this face covering rule does apply to all of Missoula County and not just the city of Missoula. Again, I just want to reiterate that the face covering is intended to protect others and keep your own germs closer to your face. We know that it's not going to be 100% effective at keeping you from getting COVID or keeping you from giving COVID to someone else if you have it and just haven't developed symptoms yet, but it is helpful in reducing the transmission. I also want to address the K-Pax Facebook poll that was active last week. That poll was a yes or no poll asking for public opinion about the face covering rule. People could respond from anywhere in the United States, not just Missoula County. We're getting a lot of feedback related to this poll as people are citing it as a public vote on whether or not the Board of Health should pass the rule or not. We're hearing that because of this poll, the Board of Health did not listen to the public vote. I just want to clarify that a poll on Facebook by a news station is just an outlet asking for public opinion. This is not the same as the health department soliciting public comment ahead of a Board of Health meeting. The Board of Health reviews the official public comment and takes it into consideration when making a decision, but it is still just that. It's public comment and it's not a vote. Comment is submitted and reviewed as one piece of many data pieces that helps the Board of Health make decisions. We've been accepting public comment as well as complaints for several months through our feedback portal on our website at missoula.co/cvirus. If you have a comment or complaint, that is a good avenue to have your comment or complaint heard, as we do have people reviewing each and every comment that comes through the portal, and they get forwarded to when it's appropriate. The other way that you can voice a complaint if you go into a business and you see that they're not enforcing the face covering rule is that you can call our environmental health division at 406-258-4755, or you can send an email to envhealth@missoulacounty.us, and that goes directly to our enforcement team. So again, that's 258-4755 if you would like to voice a complaint about a particular business that is not following the face covering mandate. I also want to talk again about the difference between antibody testing and PCR testing, as we've seen that there has been some mixed messages out there and some misunderstanding. So just to clarify, the antibody test is used to determine if you've had coronavirus. Many of the antibody tests on the market can tell you if you've had one of 5 or 6, including COVID-19, but they're not able to tell you which of them that you've had. The antibody test is a blood test, so you would go to the lab and they would draw your blood and send it out for results. In contrast, the PCR test is a test to determine if you have COVID-19 right now. This test is the most accurate diagnostic test that is available. The PCR test is performed in your provider's office or at our drive-through testing location, and they use a nasal swab or a nasopharyngeal swab that's like a Q-tip. They swab your nose or way back in your nasopharyngeal passage at the back of your nose, and they put it into a vial and they send it to the lab for testing. Usually you get those results back anywhere from 24 hours to 10 days, depending on which lab it gets sent to. And lastly, on the note of testing, we are not proceeding with testing of asymptomatic Sentinel testing at this time. Our drive-through testing clinic has been very busy, mostly with people who have symptoms of COVID-19 and some close contacts of positive cases. We're also hearing that there's a shortage of reagent at the labs around the country, and this is causing delays in lab results to come back. The reagent is what's necessary for performing the PCR test. So this means that while we have capacity to continue to test people with symptoms and their contacts, we are not able to test asymptomatic individuals at this time in order to best conserve the reagent that is available, as well as maintain capacity to continue testing. So that's it for my daily briefing. I just want to say thank you to everyone out there who is following our guidance and protecting each other from the spread of COVID-19. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. You can click that little notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. We post a lot of good information there. There has been a lot of debate on Facebook, particularly related to the face covering. So I just want to ask that if you are engaging with us on Facebook, just try to be respectful of your fellow citizens who are also on Facebook. There's been some definitely contentious conversations there. So let's just keep the debate civil. You can also call 258-INFO if you want to schedule a test, if you're having any symptoms or if you have general questions about COVID-19. I would please ask that if you are calling to complain about a business or if you're calling to complain about the face covering mandate, please do not use 258-INFO for that. Please submit a comment through our public feedback portal, or you can call 258-4755 directly to voice a complaint about a business not following the mandate. You can also find lots of good information, including the new face covering rule, on our health department website page at missoula.co/cvirus. So that's it for today. Everybody stay healthy, and I will talk to you again tomorrow. Thanks.